This is Dr. Ijadi with Sports Medicine here. We're talking about the 10 important things that I think everyone should know regarding concussions. Okay, number 1, how many symptoms are needed to diagnose a concussion? The answer is 1. One symptom is all you need to diagnose a concussion. Whatever the symptom may be, if you have it, you have a concussion. Okay, whether it's nausea, vomiting, dizziness, difficulty balancing, difficulty sleeping, difficulty with concentration, whatever it is, you could have the diagnosis of concussion as long as you have one symptom. Okay, number 2, who's more susceptible for concussions, men or women? The answer is women. The theory behind that is a weaker neck strength, okay, and higher risk of having concussions. Number 3, what are risk factors for concussions? So one answer, as we already talked about, is women. Women is a risk factor. The gender is a risk factor for having concussions. Other risk factors for concussions are high-risk sports, like we talked about, football, boxing, MMA, rugby. Those are higher risk for having concussion. Neck strength, like we talked about earlier. Prior history of concussion, so if you've had one or more history of concussion in the past, you're at higher risk of having concussions in the future. And anticipation of collision. So those who do not anticipate a collision are at higher risk of having a concussion rather than those who are anticipating a collision and are ready for that blow. Okay, number 4, does wearing a helmet prevent a concussion? The answer is no. Okay, what we know is helmets do not prevent concussions. Okay, they prevent skull fractures and damage to, maybe a laceration in the skin or bony abnormalities, but the brain still moves in that skull and in the cerebral spinal fluid, so you could still have a concussion. Number 5, does genetics play a role in concussions? We're doing more research in this and we're learning more about this, and the ApoE gene is one thing that researchers are really looking into. So yes, they do play a role in concussions. Number 6, who takes longest to recover from a concussion? Is it a child, adolescent, or adult? The answer is adolescents. Okay, so adolescents tend to have more difficulty for recovering from concussions. All right, usually the time frame for a normal concussion is about 2 weeks. If it gets more into the 3 weeks or more, then we're having a complicated concussion here. Okay, number 7, can MRI or CT scan diagnose a concussion? And the answer is no. Okay, we know MRI, CT, X-rays do not diagnose concussion. Concussions are diagnosed by symptoms and objective findings. I think the best way to go ahead and diagnose a concussion is using the SCAT-3 and making sure a trained professional like athletic trainer, sports medicine doc, or neurologist evaluate the patient. Number 8, are concussions only caused by a direct impact to the head? The answer is no. Okay, we know that you do not need to have a direct impact to the head to have a concussion. If you have a blow to the body, the head and neck still move and you could still have a concussion. Number 9, is loss of consciousness required to diagnose a concussion? The answer is no. You do not have to have loss of consciousness to diagnose a concussion, okay? If you have the symptoms of a concussion, you have a concussion. And number 10, what are the red flag symptoms and signs that you're looking for to recommend having a patient go to the ER? So the things that I tend to look for are focal weaknesses, okay? Unable to move certain areas of their body, okay? They're having seizures. They're having headaches that are getting worse, not getting better, or are not controlled with medications. Okay, if they're vomiting 2 or more times, that's usually my cutoff. I would recommend going to visit the ER for further imaging. Okay, and if you're having increased confusion and irritability that's just not getting better, again, I would recommend further evaluation. All right, this is the top 10 things that I think everyone should know about concussions. Thank you very much.